generic form of this drug is Pregabalin. This is an anti-epileptic or anti-seizure drug that is newly approved for the adjunctive treatment with adults with partial onset seizures or seizures with electrical discharge over a certain focus of the brain. Pregabalin is the first new treatment in epilepsy in 5 years. Lyrica is also the prescription medication approved for management of two of the most common forms of nerve pain. Number 1 being painful diabetic peripheral neuropathy, and number 2 being post-herpetic neuralgia, which is pain after shingles. It is important to know that pregabalin can worsen absence seizures, known as staring spells, and myoclonic seizures, which are episodes of jerking that take place. So if your seizure frequency gets worse or prolonged in duration, this may not be the right medication for you. You should discuss this with your physician and neurologist. Lyrica is usually taken 2 or 3 times a day, depending on your medical condition. Your doctor will tell you how much Lyrica to take and when to take it. You should take Lyrica at the same times each day. Lyrica can be taken with or without food. If you miss a dose by a few hours, take it as soon as you remember. If it is close to your next dose, just take Lyrica at your next regular time. Do not take 2 doses at the same time. Do not stop taking Lyrica suddenly without talking to your doctor. If you stop taking Lyrica suddenly, you may have headaches, nausea, diarrhea, or trouble sleeping. You should talk with your doctor about how to slowly stop Lyrica. If you take too much Lyrica, call your healthcare provider and Poison Control Center right away. Do not drink alcohol while taking Lyrica. Lyrica and alcohol can affect each other and increase the side effects such as sleepiness and dizziness. It is not known if Lyrica passes through the breast milk. Because of serious side effects that could occur in the nursing infant if Lyrica is passed through the breast milk, Pfizer, the maker of Lyrica, does not recommend that women breastfeed while taking Lyrica. Therefore, if you have been prescribed Lyrica and are breastfeeding or thinking of breastfeeding, make sure you let your healthcare provider know. The FDA has listed Lyrica in pregnancy category C. This indicates that the caution is advised, but the benefits of the medication may outweigh the potential risks. There have been no good scientific studies in women, but studies in animals have shown to harm the fetus. All women who are capable of becoming pregnant should have at least 0.4 milligrams of the vitamin called folic acid every day because it helps to prevent one type of birth defect known as spina bifida, in which the spinal cord is not completely enclosed. Women at high risk, such as those with a history of this kind of defect in previous pregnancies, should take 4,000 micrograms or 4 milligrams daily beginning before they become pregnant. In general, the risk of defects is higher for women who take more than one type of seizure medicine and for women with a family history of birth defects. You should call the neurology clinic or your primary care provider immediately if any of these side effects occur. Number 1 is sleepiness, 2 dizziness, 3 balance and incoordination loss, 4 is unexplained muscle problems such as muscle aches and pains, 5 is swelling in hands and feet. The most common side effects when the medication is first started or the dose is increased are number 1 drowsiness, 2 headache, 3 fatigue, 4 dizziness, 5 balance problems, 6 blurry vision, 7 trouble concentrating, and 8 dry mouth. These effects should get better with time as the body adjusts to the medication. If they are severe or persist or worsen, please inform the neurology clinic immediately. Other side effects that may occur with pregabalin are weight gain, which is indicative of toxicity, either in the form of fluid buildup or added weight. Blood levels are not taken on pregabalin at this point of time. Some drug interactions that you should know about while taking pregabalin are rosiglitazone, otherwise known as Avandia, or pioglitazone, known as Actos, for diabetes. You may have a higher chance of weight gain or swelling if these medicines are taken with Lyrica. Any narcotic pain medication, such as oxycodone, tranquilizers, or medicines for anxiety, such as lorazepam, should be disclosed to your physician. You may have a higher chance for dizziness and sleepiness if these medicines are taken with Lyrica. So you should not take pregabalin or Lyrica if you are pregnant or plan to become pregnant. You should not take Lyrica if you're breastfeeding, or if you plan to father a child. Animal studies have shown that male animals are less fertile. Also, in animal studies, birth defects occurred in the offspring of male animals who were treated with pregabalin. It is not known if these effects would happen in people. Lyrica has also been known to cause skin sores in animals. Although skin sores were not seen in studies in people, if you have diabetes, you should pay extra attention to your skin while taking Lyrica and tell your doctor of any sores or skin problems. Also, you should tell your doctor if you have abused prescription medications, street drugs, or alcohol in the past, as Lyrica has been known to give people a high. It is important to remember that all anti-epileptic drugs are thought to increase the risk of suicidal ideation. Please inform your physician of any signs or symptoms of depression, such as feeling guilty, insomnia, decreased overall energy, apathy, and an agitated state.